Is Sue still joining the call today?
Uh,
That
I'm just
no.
gonna do those brief acknowledgements, Jiwon.
Yeah.
I don't have anybody committed to joining the call, so we can
Okay.
move ahead with the call.
Okay. So everyone, you can see my screen, right?
Yeah.
Yeah. Okay. Let's get started. So good morning and afternoon, or for someone it could be evening. So hope you guys all have wonderful week. So today's agenda is as usual, I'm going to share the Odyssey news. And today we have a great topic about Pediatric Data Network. The title is Connecting Pediatric Data for Better Child Health. It's a use case in Korean Kids Network. And I invited SuHyun Kim from Seoul National University, Korea. And she's going to give us a great speech about that topic. And before we jump into next Odyssey news, um, Song's mentioned he has a quick note for everyone. So, Song, please go ahead, and so floor is yours.
Thanks, Jiwon. So,
Mhm.
for those of you who don't know, there's a lot of back-end efforts that happen to make these calls happen, these events happen in the Odyssey APAC community. And I don't think we acknowledge the people who are in the back quite often. So today I'm just going to briefly take the floor to acknowledge some of the important people in the back end who are making this happen and making sure that everything is presented at the appropriate times within the community. So let me steal your screen, Julian.
Yep.
Here you go. All right, it would be great if everyone on the list here is joining the call today. But unfortunately, as Jiwon just described, a lot of the regional chapters have some events going on in their respective regions. So we might not have them live, but hopefully they can see that they were acknowledged and know that we really appreciate their efforts. So just one by one, right? Jiwon, she's the face of the community calls here, right? So she's driving these calls. Uh, Thanks for your efforts, Jiwon. I don't think I need to say this enough. We also have Septi and Natalie who are working with Jiwon to make these community calls happen. They also individually have unique responsibilities, right? So Septi is currently taking care of the repository or essentially the recordings and the contents that are discussed during the community calls and scientific forums and making sure that this is disseminated over to the global side where the Odyssey global community is also aware of what we are doing here on the APAC side. Natalie is also taking up the APAC newsletters moving forward. Thank you for that. Ooh, speak of the devil. So, hi Natalie, we're talking about you right now.
Hi, everyone.
Thank you for your efforts in helping out coordinate the community calls and the APAC newsletters moving forward. We have Mukesh and Erwin from Singapore, who are our scientific forum leads and coordinator, respectively. So thank you for their efforts in making sure that that meeting series takes place at our usual cadence. We also have Guspella, who's recently joining the APAC operations team in being the communications coordinator. So we have various channels and where people get in touch with Odyssey APAC. Guspella will be taking the portion in which any communications to the Odyssey APAC account are appropriately addressed and forwarded to relevant people depending on the inquiries that come in. We also have Yun Yue from Singapore. Oh, another speak of the devil. Yun Yue has just joined the call. So Yun Yue, thank you for your efforts and thank you for joining the Odyssey APAC operations team. Essentially, Yun Yue is owning the Odyssey APAC LinkedIn account. So for those of you who are monitoring LinkedIn, Odyssey APAC now has a LinkedIn account which Yunue is managing and posting relevant topics
Mhm.
for your reposting on LinkedIn to make sure that Odyssey APAC is readily visible in the community and the LinkedIn communities. She is also managing the Odyssey APAC homepage. She will be reaching out to certain people in the community for updates to this as we speak right now. And last but not least, I would like to acknowledge Gan. I don't think she's in the call today, but she is the coordinator for the APAC symposium this year that's taking place in Korea. She's going through a lot of harassment from myself with regards to preparation for the event. But hopefully, she understands that this is all to make sure that we have a great event as we always do every single year. She's also PMing the APAC value study along with the study lead. So if you have any inquiries with regards to participation in the study, you may reach out to her for any questions that you may have. So thank you all for the day-to-day basis work that you do to make everything happen in this community. And I do have some photos for those of you who are not familiar with the faces and aren't able to match the faces. Don't hate me if you don't like the photos. This is what I could find publicly. This is the best I could do. If you have a problem, blame it on yourselves because you don't post enough photos online, right? So Jiwon, Septi, Natalie, Guspella, Mukesh, Erwin, Yunyue, Gan, thank you for your continuous contributions. We look forward to your seeing you in person in various events that happen, hopefully at the Korea APAC Symposium happening this year. And I would also like to acknowledge Keiko, who used to own a lot of the activities that these individuals are individually now dividing and conquer. So thank you, Keiko, but I don't think she's in the call with us either. But again, what you do for the community makes everything happen. So thank you. And I won't take up too much time. Over back to you, Jiwon, to share the Odyssey news and move ahead with the planned agenda.
Yep. Thanks, Song. I really appreciate your shout out. And like nevertheless, like big kudos to Song. I learned I learned a lot of things from Song, and yeah, thanks Song again. And moving forward, about the Odyssey news, we have a big event published last week. I saw this from the Odyssey community call. So the Atlas 3.0 is updated, and we had a lot of preview from Peter Hoffman from the Data for Life team. And these Atlas team explored a long journey and conducted extensive surveys and interviews to identify the pain points from previous Atlas 2.0. So key feedbacks highlighted a SIP learning curve and navigation and difficulties in keeping pace with the Hades libraries updates. So there was a update from here, and this is the journey that you can overview. And they Atlas 3.0 is a complete rewrite, so it's not just an update. So it migrates from the outdated frameworks to modern tech stacks, including transition to Java 21 for backend and a lot of things that I couldn't really understand. I'm not a real tech person, so I don't really fully understand all these things. But they put a lot of efforts, and I actually quoted directly from Peter Hoffman's presentation from Global Community Call last week. So everyone who are interested in this Atlas rebuilding, then you can just go to Odyssey YouTube channel and you can track on it. And also, so these are the available updates in new stacks, and also something were removed from the previous Outlet 2.0. They were mainly focused on the streamlining the workflows. So improvements include a new navigation layout and in-place editing features for cohort definition to reduce switching between tabs, and optional like patients count scale, count cache for faster insights. So, and also I heard that there's a new plugin architecture was introduced to allow the community lead extensions, and that's it. And they actually removed the population level estimation and patient level predictions, and they also trying to do more live analysis in the Hades ecosystem. And they are actually doing a preview right now. So the team is actively looking for the discussion and feedback from the collaborators. So you are very encouraged to test the preview instance, and this is the address of the GitHub of Atlas 3 preview. So you can go there and give a report box or provide feedback directly through the GitHub discussion. And I saw that team is here right now. So he is the representative of Data for Life team, and hopefully we could invite Peter through the scientific forum or get the more review of the Alice 340.
Yeah,
And
sure. Super happy to
yeah,
have him.
yeah, thanks team. Is that Peter or team? Was it?
It was
Okay.
me, Tim. Sorry,
Oh
Peter
yeah.
is
Oh,
not
hi
joining
team.
today.
Okay, hi team. So I will follow with Peter or team, whoever who could give us a Atlas 3.0 3.0. And next is our Odyssey Global Symposium is upcoming, and I know that maybe a lot of you guys got a notice from of the submission acceptance this morning, I guess. So very excited too about this year's global symposium, and there's a lot of events too and tutorials. So whoever interested in global symposium, get tuned through a lot of chains like LinkedIn, um, email, or website, anything like that. And also we had OHDSI APAC symposium. And as Galen mentioned last month, we are having we are having a 3 days program, which is the main conference, and we're gonna have a datathon too. So in the main conference, gonna go with 5 keywords: reproducible, reliable, robust, and regulatory, rapid, and regional, but global topics. And we haven't really decided the details program yet, so it's gonna be on the website as soon as possible. And about the registration fee and the registration, the registration page is not available for right now, but the early bird registration is until September 30th, 10 p.m. Eastern time. So yeah, I will get you guys updated too. And the abstract submission is until August 17th. So we have like a 1 month left. That's it. And now, so we gonna so and before we start with the Pediatric Data Network, is anyone want to chime in and gives me anything for the any news or something you guys want to share? Okay. So it's my pleasure to introduce our speaker for today. SuHyun Kim. She's currently a PhD student in the Department of Clinical Medical Science at Seoul National University. I'm very, my apologies that we usually have a lot of packs of group in OHDSI APAC community call, but we only have like half of them today. So please understand that. And I did not. I don't. So anything before we start? SuHyun is all yours. If the floor is yours, you can just get started, and yeah, you can share your screen, or if you wanna add more introduction of yourself, you can. Yeah, you can do it.
Okay, hello. In Korea, good afternoon, or maybe good morning or good evening. I'm SuHyun Kim. Thank you for introducing me. And as just introduced, I'm a PhD student at Seoul National University. And so I'm studying medical informatics, and also I'm a researcher at SNUH and with Healthcare AI Research Institution, HARI. So where I'm charged in constructing our own CDM and support and conduct researching using it. So now can I share the screen?
Yeah, sure.
Okay.
Yeah. While she is sharing her screen, she actually approached to Chan first for the chance to speak for the speech at the APAC symposium. So yeah, she has her endeavor, I think, and I think she has a lot of passion about the building a pediatric data network in Korea. So that was quite inspiring. So yeah, that's a little bit context here.
Okay.
Oh.
Oh, is the screen okay?
Yeah, I can see your screen.
Thank you. So, I'd like to attend. I'd only attend the OHDSI symposium before. It was first time at maybe 2023 at New Jersey, and last year maybe at Singapore. I don't exactly remember, but
Oh
so
yeah.
yeah.
Singapore was like a 2024, I guess. Yeah,
So,
it was. Yeah,
yeah,
that was APAC symposium, and
yeah, I've
last
been
year
there
was
before.
yeah.
Okay, so I'm so grateful for chance to introduce Kismet here on the community call. So today I'll walk you through work we've been doing over the past few years, connecting pediatric data across the hospital in Korea. So the pediatric researcher can use it more easily. So we call this network KISNet, the Korea Kids Network. So before I get into it, let me briefly introduce where we come from. Okay, so where I work, the Seoul National University Hospital, trace its roots to Daejeon, Korea's first Western-style national hospital, founded by Korean government in 1885. So today's SNUH pursued a mission of helping people live healthy, happy lives through world-class education, research, and medical care. So it aimed to the hospital was trust by the nation and its healthcare professionals, a hospital that guide the future of the life through medical research, foster the next generation of global healthcare leader, and help shape national healthcare policy. So for 141 years, SNUH has carried out its role as Korea's national central hospital. So before I start hardly, I hear that this APEC symposium is being held here in Korea at Yonsei University. So I prepared this map. So I expect many of you will be traveling into the city. So I thought I'd take a moment to show you where we are. So this is a map of Seoul. The down here in the corner, you can see the word Gangnam. I prepared the Chinese word also. Yes, the Gangnam style from the song, but the name actually means south of the river. So Gang is the Han River, and the Nam means south. So Gangnam is simply everything south of the Han River. So here's the thing though, most of Korea's history sites on other side north of the river. So if you take Seoul Station as your starting point and head north, you reach Gyeongbokgung, the royal palace of the king. So go west from there, and you will find Yonsei University, where this symposium is being held, and go east, right next to the King's Palace, sits the Queen's Palace, Changgyeonggung, SNUH stand on the very ground on the grounds of the old palace. So I hope many of you from OHDSI APAC get to explore Seoul while you're here. And just, if you wear a hanbok, our traditional Korean dress, you get into the palace for free. So please keep that in mind. Okay, now to the main topic. Our work sits within a large effort, the Child Cancer and Rare Disease Project. It began with the management philosophy of the late Samsung chairman Lee Gun-hee, respect for humanity, contribute to society. In line with that, Samsung and Chairman Lee's family donates 1 trillion Korean won, about $1 billion to Korea's healthcare sector. So the donation was split into about $750 million went to infectious disease response and $300 million to supporting children and pediatric cancer and rare disease. It led by Seoul National University's Children's Hospital. The Pediatric Data Network I am presenting today is the journey of the second stream. So this pediatric effort is organized into 3 divisions: a pediatric cancer division, a rare disease division, and at the center, a collaborative research and infrastructure division. I sit in the central one. So there are 2 goals with us. One is innovative clinical research focusing on pediatric cancer and rare disease, strengthening research capacity for several severe conditions and moving from treatment-centered care toward data-driven patient management. The other is a accurate diagnosis and safe treatment. So building an integrated genomic and children big data platform. So building the kinds of shared research infrastructure required a data standard. So at the first time, the best reference for us was PASNet in United States. PASNet is a national community of children's hospital researchers, clinicians, and families, and running observation study and clinical trial in pediatric. So its strength is that I think it standardized a wide range of pediatric data, and all maps took some common standard vocabulary. So looking at PASNet, we could see which data domain matter for children and what the underlying data model should be. So we are the home of CDM from OHDSI community. Now here we are. So as we know, OHDSI is a community of more than 3,000 collaborators across 18 countries. So that's part of why we choose OMO. So not only to connect institutions within Korea, but to link Korean pediatric data to international power. So that's what we built KISNet. We built a collaborative research network for child cancer and rare disease, establishing a common data model across children's hospitals nationwide, and improving research accessibility through multimodal data. So in numbers, 7 hospitals, 169 million pediatric patients, 5 years starting in 2022, and adopting almost standard. So now let me walk through how we grew the network, what pediatric specific data is we added, and what research is coming out of it. Okay, here is the step-by-step figure. We didn't build this all at once. We added 1 institution at a time. So we start in 2022 with SNUH, us, and our branch at Bundang. And Chungnam National University Hospital, and then Cheonbuk joined in year 2, and Gangwon in year 3, Chungbuk in year 4, and this year Cheonnam National University Hospital joined as year 5. So each step meant onboarding a new site data and mapping it to the CDM. Actually, Korea is divided into several provisions called do. So our network is spread fairly evenly across them. Seoul at the center, Gangwon in the east, Gyeonggi around the capital, and Chungcheong in the middle, and the Cholla region in the southwest. 7 hospitals are connected, holding data on 1.69 million pediatric patients. So now let me show you the details of the data. This table shows each institution's pediatric CDM as of this June. By pediatric, women, patients aged 18 or younger at their first visit at each institution. So the lead site, SNU8, has data from 2004, over 800,000 patients, and each subsite has its own coverage period and patient count. The right side shows this year's incremental build, and I won't read every row, but each site contributes a substantial longitudinal pediatric cohort kept current through regular incremental build. So I think I want to highlight the approach we took here. Rather than deciding internally what pediatric data to add, we asked the clinician first. So we survey our pediatric department by email and identify data they needed but couldn't get, and organize the answer by clinical domains. So 3 domains emerged: perinatal nursing record, maternal pregnancy and delivery history, and infection status and ventilator setting came from neonatology. And growth and body composition such as height, weight, head circumference with age-based percentile, and body composition analysis came from endocrinology and nephronology. And special tests, something like cardiac, ultrasound, pulmonary function, and allergy testing were recast across several departments. So especially some tests currently exist only as free text reports with no structured code. So we try to capture that. So what I want to say is our data list is grounded in real clinical need. Okay, and we put those recaps into the database. Here are 6 types of data. On the top, the standard clinical data, pediatric pulmonary function test, body composition monitoring, allergy tasks like multiple allergen simultaneous test and skin prick test, and NICU discharge record, and more are structured into table like measurement and observation and condition and loaded into the CDM. We also extend the model to increase the resolution of the data. So on the top of the standard clinical data, we added a multimodal layer, image and waveform. So signals and medical image can now sit within a single framework. Let me look more closely at the unstructured data side, a high value area for pediatric data. So we built extensions for 12 lead ECG, 24-hour Holter ECG, and treadmill ECG, and continuous vital patient monitoring data, and EMG and medical imaging. So these are important for assessing details, physiological function, but there are the kinds of data relational database hasn't been able to hold. So we propose the common schema for holding biosignal in the CDM. So this table is the schema. The fields like biosignal ID or person ID and concept ID and something like that, we try to follow the OMOP style, and we added the file path to let us store a range of signals in one structure. So and also with building the data isn't enough, so we has to be used. So in 2023, we opened our first call for research using the ECG extension CDM and support the project through their full lifestyle. So two projects were selected, and one was a deep learning ECG model to predict biventricular dysfunction and dilation in congenital heart disease, led by Professor Mingyong Song at SNUH, and the other, a 12-lead ECG model for its detection of mildly reduced left ventricular function in neonates, led by Professor Ji-Yu at Seoul National University Hospital. So the timeline shows the whole process from constructing the ECG extension through the call, IRB approval, interim reports, conference presentations, and manuscript submission. So I'd like to show both results briefly. The first is the congenital heart disease study. It used multiple deep learning combining 12-lead ECG from SNUH and Bundang branch with clinical metadata like age and sex. It was presented at the Spring Digital Health Society and Fall Korean Society of Cardiology meeting in last year, and the manuscript is under submission now. And the second is the neonate study. Diagnosing left ventricular function in neonates is difficult, so echocardiography is resource intensive. So the team built a CNN model to detect mildly reduced left ventricular function from the widely able 12-lead ECG alone. So in a cohort about 2,000 neonates under 1 month old, it reached an AURC of 0.87 despite the class imbalance. It also under review at a journal. So I'd like to introduce another open call research. One of the data types every hospital built in common within our network is the NICU discharge record. We standardize its entire form into OMOP terminology and structured it into table like measurement and observation. So these are the example. NICU discharge record data lead to its own call. So we opened a call in September last year, and one project was selected and began in January last year, and developing a personalized and early internal nutrition protocol for very low birth weight infant based on maturity and risk. This is led by Professor Hee-seung Cho at Gangwon National University Hospital. So we are also exploring whether this record can support data quality assessment by comparing institution level of average of variable like infant weight and head circumference. So also the data item include general gestational age, birth weight, Apgar score, intraventricular hemorrhage, and MRI findings. So we opened the call every year. So this continues into this year and next. In 2025, we have a project using extended NICU vitality V data. It is the patient monitoring data. And one using extended chest X-ray TICOM data in children with lower respiratory tract infection. So for this year, we are planning to call using echocardiography DICOM data. So as you know, the pattern is consistently we build new data and extend the CDM and open it for researchers to use. So next is the last slide. Now let me close by returning to where I began. All of this began with a donation from the late Samsung chairman Lee Gun-hee. And carrying that forward, we built a nationwide pediatric network over 5 years and 7 hospitals, 1.69 million children, and a multimodal extension. So, and it is already producing real study and publications. A network matters where people join it. So if you like to do research together with Korean pediatric data, or if you are building something similar, please reach out and collaboration is always welcome. Thank you.
Thank you, Sian. That was a that was a great presentation actually, because I've come to realize that the collecting the data like truly needs for a high quality pediatric research, and building a database is not something that you can like do it in a 1 year or like 6 months, right? And like something impressive was like you guys like collected 6 different types of data that actually asking by clinician that what is the data that grounded from the real clinical needs, right? So that was very inspiring, I guess. And before ask someone else who has a question, I heard that you got you keep mentioning the open research. The what was that like a? It was a open call research, right? So
Yeah.
you got So you are actually um, collecting more collaborators from the community. Is
Yeah,
that your
of
point? Ah,
course. Yeah.
cool.
We start 2023 with ECG extension model,
Mhm.
and we consider this um, opportunity both within both sides need to keep open. So we always welcome to contact us to collaborate it with any data you need or you are interested in. So please just contact me. I added my email
Email there.
below
Yeah.
here. Yeah.
Yeah. One more question before yeah. So you have like 5 different hospitals, like different consortiums, right? Hospitals joining this KISSNet. Is that right? Yeah. Do you have any ideas or opportunity to do your research from the um, over overboard hospitals like other countries rather than Korea? Because yeah, I think yeah.
Um, did I understand right? I don't, I'm not really sure. You are asking me to, I, do we have any planning to reach out abroad, right?
Yeah. Over yeah,
Yeah,
oh yeah.
yeah, actually, this is why I'm here. We want to
Mm-hmm,
start it within APAC and we want to
mm-hmm,
try to reach out
mm-hmm,
maybe US or Europe. We
mm-hmm,
are always open to collaborate with abroad. So why we adopt Omop CDM to build our KISSNet. So
mm-hmm,
this is uh, be a answer to you.
mm-hmm. Yeah, I totally
Okay.
answered my question.
Thank you.
Yeah. Um, anyone on the floor was oh yeah, hi team.
Yeah, great. Thank you very much for the presentation. I was very curious about the CDM extensions you've presented, and I've just recently saw a poster from MIT and Tufts where they also presented a waveform extension. And we are right now looking in integrating this in data to evidence, but if there's also other extensions available and floating around, we would be very curious to learn more about this. So have you published this maybe already somewhere?
Not yet, actually. As I present just before, we starting at 2022, and we build the ECG extension for the first data type to extend the biosignal types. So we not yet publish any published paper, not yet. And we'd like to integrate or discuss together to unify the schema. But at that time, at 2022 or 3, we were just need to build and construct the database. So we didn't publish yet. Yeah.
Yeah, super cool. Very curious to see more. And I just posted the link to the group there, and I'm super happy to make an introduction. So I meet with Brian quite regularly, and I think he's very active there. And they're now planning to roll this version out in the US, I think.
Great, thank you.
Team, about the link that you just sent through the chat, I cannot open it. It says the site is under maintenance mode.
Okay, let me try to share the PDF directly because I can open, but maybe it's not accessible from Korea.
Oh yeah, yeah.
Let me get the PDF.
Okay, so before team prepare for the his PDF thing, Kiri, you raise your hand.
Yeah. Hi, Seon, and thank you for your great presentation. And I think for pediatrics patients, there are a little data in one institution, so CDM networking is really essential. And almost CDM is the best one. And I have a question that I understand that in your research team, you also consider medical imaging CDM, which is imaging working group constituted, and you used it for ECG data for adult patients.
Right.
And I in your presentations, I checked you used your institution's own ECG data framework. So it is only for pediatrics, and for adults, you consider imaging CDM for ECG or the same architecture in pediatric CDM?
Thank you for asking me, Yuri. Actually, we was working together with another project, the labor funding multimodal CDM. As you just asked me, actually, to 1 or 2 years ago, Professor Chan proposed the medical imaging CDM, right? And actually, at the same time, maybe the gap was 1 month, only 1 month. At Bundang Seoul National University Hospital, there is SuHyun professor. She also proposed another model for medical image CDM. It was also another types of extension model for image. And actually, she is involved in our network. So in SNUH, we maintain both types of schema for ECG and the medical data, the DICOM data. So actually, internationally, many extension model to collaborate or integrate with almost standard model is proposing very widely and actively, I think. So until OHDSI will almost pick one schema extension for the unstructured data, maybe we could maintain as we can maintain, maybe we could choose any schema to maintain the CDM, because I think our work is to support the researcher to researching the data, clinical data, with using almost CDM. So this is my answer. Thank you.
Thank you.
Iran, your hands are raised.
Hello,
Yeah.
thank you so much for such a lovely presentation. My name's Ilan Mears. I'm from Australian Research Data Commons, and I work really closely with Jat Janeski on the call and Professor Nicole Pratt in the Australian Health Data Evidence Network project. I wanted to ask, you presented such a beautiful and really well thought out process of building each individual data set and then getting people to use that data and really demonstrating the value of it in a staged way rather than sort of trying to tackle all possible data items that you've demonstrated such a logical process. Could you tell me a little bit more about how your open calls work for other networks being built internationally? We're really interested to understand how you're generating your user base for your data assets. Are they funded research calls? What is the how are the projects selected, or what is the participation criteria, I guess? I'm interested to know.
Okay, thank you. Thank you for the great question. Actually, until nowadays, we open the open call research at our project site, and it is only in Korean. But because we built this asset with almost CDM, and also the reason why we adopt OMOP. So just like at every collaborative study in OHDSI, you just contact me and maybe we could discuss together which research could start. And maybe you should send me the JSON file and I can count the code size, and so there isn't a specific way to start the collaborative study. And also, even if this is a funding with a project with funding, there is a limitation to support within a budget. So we just try to support researchers who want to use our data. We support the technical skill, and maybe we could arrange the right researcher to. It could be possible, I think.
Thank you.
Thank you. I'm very glad to. Actually, I'm very glad to. There is so many questions and.
Yeah, I was gonna say that like the discussion is so all over the place today, so I'm very excited. And I see Chungsu, he raised his hand. Yeah, Chungsu.
Hi, this is SuHyun Kim from Seoul University, and first of all, thank you for your great presentation, and thank you for all the effort. I'd like to ask your personal thought based on your experience for the pediatric CDM, pediatric data. So, what kinds of data, or what types of data modality was hard to get or hard to collect, hard to standardize to the pediatric CDM, and maybe hard to use for the further analysis. And I'm also curious about any challenges you stuck in before. So you may want to share to community, or just every step was so smooth or nicely done.
Thank you. That was a very sharp question. Actually, among the data types I present today, the hardest were to collect and translate and transforming was ECG data. We have three types of ECG. One is 12 lead and other 24-hour Holter data and treadmill. We have three types of ECG, but the 12 lead data is collecting at the server, or some vendor is collecting and maintaining. So it was easy to collect, but it require us much cost to download. So it was a little bit difficult, and other two types of ECG was actually just saved at the computer and the device. So the data was disappear after a few times after take the test. So the cardiology department asked us to save that data, not for just disappear. They didn't want to disappear because the data are very big asset in hospital. So we collect them. So we try to collect them to make some macro file and built in that device and computer at the test room, and we hardly get that data type. We hardly get that data, and also the 24-hour ECG is very long and big file. So controlling that file was a little bit hard. So what I want to say is the device data, which could disappear before, was a little bit hard to save and make that asset to the research.
Okay, thank you for sharing your experience. Thank you.
Thank you.
Okay, that was very useful live tip that from SuHyun, that who actually built a very useful resource for the pediatric study. Thank you, everyone. That was a lot of discussion, and I really loved it. And yeah, anyone who wants to have more question, it's your time. We have like a 5 minutes left, but if we don't have any questions, we can just end the call for today. Anyway, thank you, Sian, for coming and joining the APAC community call. You guys are always welcome. So, because I want to see new faces every time. Sian, if you have time, you can join APAC community call every month. Uh, yeah, and for next month, we're gonna have a APAC regional update. So there's gonna be a huge topics because we have Indonesian chapter from this year, and so we have like 11 countries in APAC region right now. So that's it, and yeah, okay, then that's it. So everyone have a good day, and it's gonna be a long weekend in Korea. So hope you guys have a good weekend too and good week. Thank you. Bye. Bye bye.
Thank you.
Thank you.
Bye
Bye
bye.
bye.